Thank you, and good morning. It's a wonderful morning. Let's say hi to everyone in there who's working. Y'all are being shy in there. Don't be shy. I want to thank, before we start, the folks that are right here inside here. These are the folks who get up every day and show compassion, show love, show empathy. They help folks, they treat folks, they get them on the path to a better life. And I know you're all hidden back in there, but I want you to know we appreciate you and we value you and we thank you for being here. I want to thank Abby and Melina for being a really good partner. Time and again, when we have a problem and we need partners to step up and help, Molina Healthcare steps up to help. And they do it every day with what they do, but then when we need them to go above and beyond that, to say, look, this is an important program, we need some help, they step up and we help. And so, Abby, we're really grateful to you and the entire team at Molina. And so on behalf of the county, thank you for your continued help. And Family Health Centers, I got to say a word about Jeff and Family Health Centers, because every single time we have something difficult and hard, no matter what it is, we're like, we should call Family Health Centers. And Jeff, every time you and your team step up, and you've been doing it for decades, and I'm pleased that we now have a county that is more supportive and more engaged in supporting you in the work that you have been doing for decades on end, and it's about time. Addiction has such a stigma in our society, but the reality is someone who faces addiction is no different than someone who faces high blood pressure. It's no different than someone who faces diabetes. The only difference is if we had a world-renowned treatment program for high blood pressure, and we knew it worked, we had 20, 30 years of data that shows you it definitively works, nobody would question for a second, not for 1 second, if we ought to do that. It's only when it comes to addiction that the world-class services that we know can help people are the ones who go, wow, I don't know if we should do that. But there is no difference. It's an individual who's got a chemical imbalance in their body and they need a little bit of help. There's good folks, there's a humanity that exists the same. And I would venture to say that everyone in San Diego County knows someone whose life has been impacted by addiction. Maybe themselves, maybe a family member, a coworker, a friend, a loved one. Everyone knows someone. And I will tell you, there's nothing I won't do. Having met with parents who have lost their children to addiction, and being a parent yourself, there is nothing that we should not do to try and tackle the epidemic of addiction in our country. And the reality is syringe services simply work. One of the most effective ways to engage people and promote public health, lowering Hep A and Hep C and HIV, but it's also the entry point into treatment. Individuals who come here get some compassion, they get someone who values them as a human, they get someone who says, I care about your health, and by the way, when you're ready, we can help you tackle what you're facing every single day. And it has no boundaries. Addiction has no boundaries. The issue is often seen as one of this is an intently inner city type problem. It's not. The highest areas of increase in addiction and overdose death are East County and North County. This affects every economic status. It affects people who live on the coast. It affects people who live in wealthy communities. It affects people across the board. And so we are here in North Park in an incredible program that continues to run, and it doesn't disturb the neighbors, and it does it safely and it does it responsibly. But the reality is we need more of these services. And it was a fight at the county. They had a policy adopted in 1997 to say we're not going to take state funding and we're not going to allow county resources to be spent on things we know can save people's lives. I tried to change it once. We came up a little bit short. People said, are you disappointed it didn't pass? I said, I'm motivated. I'm not done. Eventually, what is right is what will happen, and we were able to get that through. And the 180 shift we're taking around a failed war on drugs will not be realized, and people will not be able to get the help they need without incredible partners like Family Health Centers, like Molina Healthcare, and in particular these individual workers who do the real work. For me, I can pass things and I can write legislation. Writing legislation is just paper. Voting aye is just words. That doesn't actually help anyone. What helps people is the folks you see right here. The folks who come out here every single day and engage with folks. The folks who make this happen. And so for all of those We are incredibly grateful. All of our efforts around comprehensive harm reduction will continue at full speed. We will fight through opposition. We will fight through resistance. We will fight through a 1970s mindset. I sometimes say an 8-track approach in an iTunes world. And we will continue to do it, because at the end of the day, if there's one parent who doesn't bury a child, everything we've done is worth it. And so we will continue to tackle the issue of addiction, of substance abuse, to give people a chance to a full and fulfilled life. And so again, thank you so much to everyone who is here. And your county, we're doing more than we've ever done, but it's still not enough. It is still not enough. And we will continue to push ahead and do more. But thank you to Family Health Centers. Thank you to Molina Healthcare. And this is a really, really good day to celebrate. So thank you all.